So hello everyone, today we are going to discuss is about the Neet 24 paper discussion. So let us start with the first question. A young patient came to your clinic with a history of owl's tooth, with the trauma having happened less than 10 minutes prior. The patient has tooth with himself. What should be done? The answer is wash with saline and reimplant. So let us discuss how. A young patient has come to the clinic with the owl's tooth. So that means that this tooth has been completely knocked out of its socket. That happens due to the trauma. Now this is a time sensitive situation, and our primary goal is to preserve the tooth. So what would be our primary goal? The primary goal is to preserve the tooth, and next goal is to reimplant it. So we have to increase the chance of successful reimplantation. Now the correct answer here would be wash with saline and reimplant. Now remember the time. The time is of essence. The sooner we can reimplant the tooth, there would be better chances of its success. So according to the guidelines, owl's tooth should be ideally be reimplanted within 30 minutes. That is what you have to remember for your entrance exam. So the owl's tooth should be ideally reimplanted within 30 minutes. So acting quickly is important. So next we need to prepare the tooth for the reimplantation. We just rinse it with saline to remove any debris and keep it clean. So that would help to maintain the viability of the tooth and reduce maintain viability. And second, it would reduce the risk of infection. So then we reimplant the tooth back in the socket and restore its position and allow for the possibility of reattachment to the surrounding structures. So after the reimplantation, we need to stabilize the tooth to prevent further damage. So that is done by splinting the tooth in functional position. So that splinting would help to immobilize the tooth and promote the healing. Now, what are the key points that you should know for your entrance exam point of view? So first is the tooth should be reimplanted with doxycycline. So that is done to initiate the process of the attachment by the collagen formation. And what is the time for the splinting? According to the guidelines by IADT, that is International Association of the Dental Traumatology, the splinting should be done for 4 weeks. Another important thing is the storage media. The patient saliva or the fresh milk, it is recommended, as it is best transport media for the owl's tooth. However, the best media, if available, is Hank balance salt solution, that is HBSS solution, that is Hank balanced salt solution, right? So that is always a good option, providing up to 24 hours of protection. The fluoride antibiotics, remember the fluoride antibiotics, they should not be applied to the root surface of the avulsed tooth. Immediate reimplantation, ideally reimplantation should be done within 60 minutes of the injury for the best prognosis. So let us discuss what are the protocols for teeth with the mature apex. So if the time is less than 15 minutes, so remember, if the time is less than 15 minutes, you have to rinse the tooth to remove the debris, flush the socket, reimplant the tooth and splint in the functional position. So if the time is 15 minutes to 1 hour, you have to place in Hank balance salt solution for 30 minutes, flush the socket, reimplant the tooth and splint it. So if the time is 15 to 1 hour in a non-physiological solution, you have to you can place the tooth in Hank balance salt solution for 30 minutes, flush that socket and reimplant the tooth and splint it. So if the time span is greater than 1 hour, so that is a more extensive procedure. So that involves the removal of the remnants of the periodontal ligament, instrumenting the canal. You have to soak the tooth in a stannous fluoride solution, obturing the root canal, coating the tooth with the endogain and reimplanting the tooth and again splinting it. For tooth with the immature apex, if time is less than 15 minutes, then you have to soak the tooth in doxycycline solution, reimplant it and split in a functional procedure. So if the time is 15 minutes to 6 hours in a physiological solution, then you can soak the tooth in doxycycline solution, flush the socket, reimplant and splint it. If the time is greater than 1 hour, then the procedure is similar for the tooth with the mature apex. So for your entrance exam, just remember that the answer would be the you have to wash with saline and reimplant, because as the time span here is just 10 minutes prior, so you have to just, so time is, remember, is of essence, and you have to just wash it with saline and just reimplant it. Moving to the next question, which of following statement is true for the cleft lip? Well, the answer is the left side. It is more common than the right side. So remember, among the unilateral cleft, the cleft involving the left side, they are seen in 70% of the cases. So in 70% of cases, you will see left side, they are more common. Remember, the unilateral cleft, they account for the 80%, and bilateral cleft, they account for the 20%. So remember that unilateral, they are more common than the bilateral. Option B is occurs in female. Well, the cleft lip, it is more common amongst the question is asking about the cleft lip. So remember that the cleft lip, it is more seen in males. Cleft lip is more common in males. Cleft lip with or without palate, it is more common in the males than in females, whereas the cleft palate is more seen in females. So option B is for the cleft lip. The answer would be it is occur more frequently in the males, whereas in females, remember, cleft palate is more common rather than the cleft lip. So option A is correct, B is wrong. Bilateral cases, they are more common as compared to unilateral. We discussed that the unilateral cases, they account for the 80%, whereas the bilateral cases, they account for the 20%. So this option is also wrong. The last option is not commonly associated with congenital deformity. We know that cleft lip in fact a congenital deformity, a condition that is present at the birth. Moreover, it is often linked with other congenital abnormalities. So stating that it is not commonly associated congenital deformity is incorrect. So option D is also incorrect. Now, what are the key points that you have to remember for your exam? Few key points that are important you should know are remember that the incidence of the cleft lip, it varies among the different racial groups. Remember that in Negroids, it has least incidence. So remember, in the Negroids, it has a least incidence, and Mongoloids have higher incidence. So that is one important point for your entrance exam. Other you have to remember is the cleft lip is more common among the males. Cleft lip or without palate, it is also prevalent in males than compared to the females. While the cleft lip is more common among the males, cleft palate, it is more common in the females. Already discussed that. Other important thing that is you get a question in exam is what is Simonard's band. Now remember that. Remember the incomplete cleft that affect only a portion of lip, and it contains a band. It contains a bridge of tissues. So there is a bridge of tissue that connect the central and lateral lip, that is known as Simonard's band. Other important thing that usually is asked in the entrance exam is the incidence of cleft lip. Well, the incidence of cleft lip and palate, it is reported as 1 in 600, and incidence of isolated cleft palate, it is 1:1000. So for this question, which of following statement is true for the cleft lip? The answer would be A, the left side is more common than the right side. So this is the Simonard's band. This question has been asked in one of your AIMS entrance exam. Next question is the cleft lip. It is formed due to the fusion of. Well, the answer would be a frontonasal process with the intermaxillary process. Now this one is the frontonasal process. Well, the frontonasal process, we know it's a prominent structure that develops during the early embryonic development, and it contributes to formation of the face, and it is derived from the neural crus cells and the mesoderm. So what are the structures that the frontonasal process give rise to? The forehead, bridge of nose, and the primary palate. Whereas the intermaxillary process, this one is the intermaxillary process. So it is also known as the primary palate. So it originates from the fusion of the median nasal process. So this median nasal process, they fuse and they form is the intermaxillary process. So it originates from the fusion of the median nasal process, which are the extension of the frontonasal process. So the intermaxillary process plays an important role in forming the central portion of the upper lip, philtrum, and the primary palate, including the incisor teeth. So in normal development, the intermaxillary process, it fuses with the maxillary prominence on either side, forming continuous upper jaw and the lip. So if there is failure of fusion between the intermaxillary process and frontonasal prominence, you can see is the cleft lip. So cleft lip occur when there is a gap or opening in the upper lip, often extending into the nostril. So this gap occurs due to the incomplete fusion of the facial structures during the embryonic development. Typically the intermaxillary process that fails to merge so the answer is frontonasal process with the intermaxillary process. So another important thing that you have to remember is unilateral cleft lip, that is also known as hair lip. It occurs due to failure of fusion of median nasal process with the maxillary process. Since that's not the option here. The midline defect of the upper lip, that occurs due to the defect in development of the lowermost part of the frontonasal process. So that's the option. That would be the answer. The midline defect of the lower lip, it is formed due to the defective fusion of the mandibular process. The oblique facial cleft occurs due to the non-fusion of the maxillary and the lateral nasal process. Coming to the next question, a patient with bronchial asthma and implant requiring rinsing after mouthwash should use which of following medications? The answer is ipratropium. We know ipratropium, remember, it is a bronchodilator. So that is commonly prescribed for patient with bronchial asthma. How it works? It works by relaxing the muscles around the airway that helps to relieve the bronchospasm, and that would improve the airway to the lungs. Now the patient with asthma, we know he will experience bronchospasm that can be triggered by various factors including irritations or the allergies. So the patient with a dental implant requires special care to maintain oral hygiene and prevent the complication. So rinsing the mouth after using mouthwash is recommended for patient with implant to remove any residual mouthwash and so ipratropium, it is suitable for patient with asthma who require rinsing after mouthwash because it is not associated with any adverse effect on the oral tissues. Its bronchodilator properties make it effective choice for managing the bronchial asthma while minimizing the risk of complication related to oral hygiene routines. So ipratropium would be the preferred medication for patient with bronchial asthma who require rinsing after mouthwash due to its effectiveness in managing the bronchospasm. So that is why answer is A.